Are you considering lumpectomy with radiation and want to hear how this can affect aesthetics? What are the risks with this approach? In today's video, we're going to discuss lumpectomy with radiation for breast cancer from a plastic surgery perspective. Make sure to stick to the end where I will discuss how plastic surgeons can help with your aesthetic goals after you've completed your treatments. Hi, I'm Ramon Garza. I'm a board-certified plastic surgeon who specializes in complex breast reconstruction and aesthetic surgery of the breast and body. I make educational videos related to plastic surgery. If you like this sort of content, make sure to like and subscribe to our channel. Lumpectomy with radiation, also known as partial mastectomy, is a form of treatment for breast cancer. It can be an option for some patients and could be the best option depending on a patient's preferences. It's an option that should be discussed by your breast surgeon. So what is it in layman's terms? Basically, it's removal of a portion of the breast that has breast cancer. After removal, and once healing has taken place, radiation is then given to complete the treatment process. Not everyone will be a candidate for this type of procedure, but those that are should have the same survival outcomes compared to someone who has a mastectomy. So who is the ideal candidate? Patients who are good candidates for this procedure are those that have larger breasts, their tumors are small, and located in areas that will not significantly change the shape or contour of the breast. They should be relatively happy with the size and shape of their current breasts. So what are the drawbacks? The major drawback to this procedure is the unpredictable nature of how radiation will affect the tissues. The main concern is that the tissues will become fibrotic and create an unappealing appearance or shape to the breast. So what can be done from a plastic surgery perspective if you're not happy with how things look after your procedure and radiation treatment? Some strategies that we can employ to help with contour issues in the treated breast include fat grafting and sometimes scar revision. However, doing a more significant surgery on the treated breast, such as a breast lift or a breast reduction, is a risky type procedure, and I don't recommend this for most patients. The risk with these procedures is from the radiation. Radiated tissues are more prone to having wound healing issues and poor outcomes. Take this patient, for example. She came to see me after treatment of her left breast. She was a fairly good candidate for a lumpectomy with radiation and has an overall acceptable outcome. However, this patient is unhappy with her breast size and asymmetry. The best treatment plan for her would have been to do a breast reduction surgery on both sides to reduce the breast size and give her better symmetry. But with her history of radiation as part of her treatment and the tissue changes that I saw on clinical exam, I felt that I could not safely recommend this as an option to her. The only option that I can offer this type of patient is fat grafting to the left breast to help with some of the volume discrepancies. But this patient did not feel this would help reach her goals. So we elected to leave things as is, and she will follow up with us as needed or if she changes her mind. Sometimes it's hard to say no to a patient, such as this case. I wish I could have offered her to do the surgery, but in my experience, these clinical situations are at high risk for having a bad outcome, and the last thing I want to do is cause harm to a patient or create a worse situation. If you found this video helpful, please like and subscribe to our channel. Don't forget to check out our website where we have other helpful information, and you can see the types of procedures we do as well as before and after photos. Also, check out our social media on Instagram and Facebook. Thanks.